Hi guys, let's continue reading the Social Security section of June 2020 Vision IAS Current Affairs. Now let's come to the fourth topic, that is COVID-19 and India's healthcare sector. So, why was this in the news? The COVID 19 crisis has highlighted glaring gaps in India's healthcare sector. At the same time, it offers a window to restructure and strengthen India's healthcare infrastructure. More on news. In the Global Health Security Index, which measures pandemic preparedness for countries based on their ability to handle the crisis, India ranked 57th, lower than the US at first, the UK at second, Brazil at 22nd, and Italy at 31st, highlighting India's vulnerability. Major healthcare issues highlighted during COVID 19. The first one is availability of basic infrastructure. India has 8.5 hospital beds per 10,000 citizens. One doctor for every 1,445 citizens, whose prescribed norm is 1 is to 1,000 and 1.7 nurses per 1,000 people, whose prescribed norm is 3 is to 1,000, which makes the situation more complicated. Lack of adequate number of ventilators in hospitals is one of the major deficiencies suffered by patients with severe COVID-19 infection. Availability of limited accredited diagnostic labs has further delayed testing and consequent understanding of disease progression. Uneven distribution of healthcare workforce. Most of the workforce practice in metropolitan or Tier 1 or Tier 2 cities, creating personal deficiencies in small towns and villages. Denial of healthcare. Despite private hospitals accounting for about 62% of the total hospital beds as well as ICU beds and almost 56% of the ventilators, they are handling much lesser workload compared to public hospitals. Private hospitals are reportedly denying treatments to the poor, along with the cases of overcharging patients. This has been seen in Bihar, which has witnessed an almost complete withdrawal of the private health sector, which has nearly twice the bed capacity of public sector. Negative perception of medical career. The stories of shortages of PPE leading to health workers getting infected and health workers getting attacked by infuriated patients and relatives, etc., may create a negative perception towards medical career in India in long run. Gaps in urban health services and urban planning. The coronavirus pandemic has disproportionately affected the urban areas and has highlighted that many large urban conglomerations lack public health services, especially the suburban regions. Dysfunctional State of Integrated Disease Surveillance Program ISDP. It was launched in 2004 to strengthen decentralized laboratory-based IT-enabled disease surveillance system for epidemic-prone diseases, to monitor disease trends and to detect and respond to outbreaks in the early rising phase through trained rapid response team (RRTs), but it continues to struggle for manpower and resources and has failed to create a robust and decentralized data collection system involving the district health system across states. India's dependence on imports over the last few decades, India has emerged as the pharmaceutical hub of the world, but it still imports 68 to 69% of its active pharmaceutical ingredients (APIs) requirements from China. So it still imports 68 to 69% of its active pharmaceutical ingredients (APIs) requirements from China. This belief in alternative or traditional medicines for treatment. Traditional medicines enterprises in India faces major issues today such as lack of research in Ayush treatments, lack of precise standards for herbal formulations. Many traditional health practitioners do not reveal exact recipes, fearing intellectual theft. As a result, efficacy studies are either absent or poorly executed. Okay, so the traditional medicines enterprises in India faces major issues today such as lack of research in Ayush treatments, lack of precise standards for herbal formulations. Many traditional health practitioners do not reveal exact recipes fearing intellectual theft. As a result, efficacy studies are either absent or poorly executed. Lack of focus on preventive healthcare. Of all healthcare spending, only 7% was spent on preventive healthcare, while more than 80% was spent on treatment and cure as of financial year 17. Gaps in care of non-COVID-19 patients. Extreme focus on containment of COVID-19 infection is likely to result in missed opportunities for timely diagnosis and treatment of other chronic diseases. Opportunities and way forward. The response to the pandemic offers an opportunity to bring about structural changes in India's health policy. Near and medium term measures. Reducing the chances of hospital acquired nosocomial infections. Need to ensure that COVID-19 does not cause denial of hospital services of non-COVID patients. Disruption of immunization as well as other programs should be addressed at the earliest to avoid preventable deaths in the future. Ensuring supply of affordable medicines. PM-BJP, Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana outlets can be leveraged to ensure that essential medicines are available in adequate supply. So PM-BJP outlets can be leveraged to ensure that essential medicines are available in adequate supply. Use of technology, for instance, Arogya Setu app helps track coronavirus patients and the people they come in contact with. Union Ministry of Health is currently working with partners to establish an interfaith Corona Coalition to engage religious communities in action against COVID-19. Now let's come to long-term measures. Upgradation of public health services. States with robust public health systems like Kerala have been far more successful in containing COVID 19 compared to richer states like Maharashtra and Gujarat, which have understaffed public health systems. Given this background, now is the time to reinvent and rejuvenate public health services across the country, for which health budgets must be substantially upgraded. In fiscal year 2018, the value of public health expenditure by states and union territories together is estimated to be around 1.28% of the country's GDP. Primary health care must be given importance. All public health activities required for epidemic control, including testing, early detection of cases, and various other preventive measures, are being carried out by primary health care centers. However, the proportion of the Union health budget allocated for the National Health Mission, which is focused on supporting primary and secondary health care, was reduced to 49% in 2020-21 from 56% in 2018-19. The declining trend for support to primary health care must be reversed. Improving robustness of pharma supply chain. India needs to diversify its sources of raw materials as well as destinations for products. This is a good time to end the dependency for bulk drugs or APIs on China by either emerging as a major manufacturer or facilitating partnerships with other countries. Revamping urban health services. There is an urgent need to launch a massive program for revamping of urban health services focused on primary health care along with major upgradation of urban living conditions, especially in non-notified slums, which must be recognized as integral to the city. Innovative approaches. Recognizing the increased need of hospitals across the country, several indigenous approaches are being recognizing the increased need of hospitals across the country, several ingenious approaches are being explored, such as converting train coaches into isolation wards, making mobile hospitals which can be taken to locations throughout the country as per requirement. Creation of Central Bed Bureau as recommended by Supreme Court in 1997 to ease the pressure for emergency beds. The Bureau should be equipped with wireless or other communication facilities to find out where an emergency patient can be accommodated. Promoting preventive health care. The huge and expanding network of health and wellness centers HWCs within the Ayushman Bharat program could become centers of health promotion as well as disease prevention. These could also act as hub of community level monitoring. Boosting private sector investment in social sector infrastructure through public-private partnership mode. To enable this, government has enhanced viability gap support to 30% of building hospitals in Tier 2 and Tier 3 cities from 20%. Okay, so boosting private sector investment in social sector infrastructure through public-private partnership mode. To enable this, government has enhanced viability gap support to 30% for building hospitals in Tier 2 and Tier 3 cities from 20%. For more measures announced for health sector as a part of Atmanirbhar Bharat Abhiyan, refer to Vision IAS Current Affairs, May 2020 edition. Now let's come to the fifth topic, that is Global Education Monitoring Report 2020. So why was this in the news? UNESCO recently published Global Education Monitoring Report 2020 titled Inclusion and Education All Means All. Now let's come to United Nations Educational, Scientific and Cultural Organization, UNESCO. It is a specialized agency of UN that seeks to build peace through international cooperation in education, the sciences and culture. Its headquarters are located in Paris, France. It has 193 members including India and 11 associate members. Now let's come to the key highlights. An estimated 258 million children, adolescents and youth, or 17% of the global total, are not in school. Globally, 1 in 12 primary school age children, 1 in 6 lower secondary school age adolescents, and 1 in 3 upper secondary school age youth are out of school. In low and middle income countries, adolescents from the richest 20% households are 3 times more likely to complete lower secondary school than those from the poorest families. In 10 low and middle income countries, children with disabilities were 19% less likely to achieve minimum proficiency in reading than those without disabilities. Now let's come to international declarations for inclusive education. Sustainable Development Goal 4, SDG 4. It aims to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. 2006 UN Convention on the Rights of Persons with Disabilities, CRPD. It guaranteed the right to inclusive education. Now let's come to inclusive education and its importance. Inclusion is a process of systemic reform embodying changes and modifications in content, teaching methods, approaches, structures, and strategies in education to overcome barriers to provide students of all ages with an equitable and participatory learning experience and environment that best corresponds to their requirements and preferences. It focuses on the full and effective participation, accessibility, attendance, and achievement of all students, especially those who are excluded or at risk of being marginalized. Benefits associated with it: improvement in academic achievement, social and economic development. Okay. Improvement in, what are the benefits associated with it? Improvement in academic achievement, social and emotional development, self esteem, and peer acceptance. Including diverse students in mainstream classrooms and schools can prevent stigma, stereotyping, discrimination, and alienation. There are potential efficiency savings from eliminating parallel structures and using resources more effectively in a single inclusive mainstream system. Promotes inclusive societies. and is a prerequisite for democracies based on fairness, justice, and equity. It provides a systematic framework for identifying and dismantling barriers for vulnerable populations. Now let's come to the challenges. The first challenge is national law do not reflect commitments made under international conventions. Worldwide, general or inclusive education laws focus on people with disabilities in 79% of countries, linguistic minorities in 60%, gender equality in 50%, and ethnic and indigenous groups in 49%. Definition of inclusive education does not cover all learners. While 68% of countries have a definition of inclusive education, only 57% of those definitions cover multiple marginalized groups. Lack of desire to make education more inclusive. 1 in 3 teachers in 43 mostly upper, middle, and high income countries in 2018 reported that they did not adjust their teaching to students' cultural diversity. Teachers, teaching materials, and learning environment often ignore the benefits of embracing diversity. Prevalent segregation of students. In the case of students with disabilities, laws in 25% of countries make provisions for education in separate settings, 10% for integration, and 17% for inclusion, the remainder opting for combinations of segregation and mainstreaming. Need of targeted financing. Socio-economically disadvantaged schools and classrooms are more likely to have less qualified teachers. Impact of COVID-19. School closures placed unprecedented challenges on governments, teachers, students, and parents aiming to ensure learning continuity. Only a minority of countries, mostly high income countries, have the basic infrastructure to facilitate online approaches to teaching and learning. Uh, Before we continue, let's read this. India's efforts towards inclusive education. The Right of Persons with Disabilities Act 2016. It mandates provision of accessible transport systems and universal design in public buildings and education facilities. Right to Education Act 2009 requires primary schools to be located no more than 1 kilometer from a child's home. Following a 2014 Supreme Court ruling recognizing the status of transgender people, the United Grants Commission called on universities to include the category on all application forms. The draft National Education Policy states that universal design should be applied to schools, building design, sports facilities, and general environments so all children benefit. In India, the share of teachers from scheduled caste, which constitutes 16% of the country's population, increased from 9% in 2005 to 13% in 2013. Steps taken by states. So, what are the steps taken by states? The first one is Tamil Nadu state set up a state resource center for inclusive education. Andhra Pradesh and Maharashtra states arranged transport for children and their parents as they closed small schools. Bihar State ensured representation of parents of learners with disabilities on school management committees. Now let's continue with the impact of COVID-19. So school closures, the next one is only a minority of countries have the basic infrastructure. Next is learners. Learners with disabilities are at higher risk of exclusion in distance learning. For instance, many resources are not accessible for blind or deaf students. Children with mild learning difficulties, such as attention deficit hyperactivity disorder, may struggle with independent work in front of computer. About 40% of low and lower middle income countries have not supported learners at risk of exclusion during the COVID-19 pandemic, such as those living in remote areas, the poor, linguistic minorities, and learners with disabilities. Increasing social isolation has also increased the risk of marginalized students disengaging further from education and leaving school early. Cancellations of exams in many countries, including India, has led to the concern that scoring based on teachers' judgments may be affected by stereotypes about particular types of students. Now let's come to recommendations. Widen the understanding of inclusive education to include all learners regardless of identity, background, or ability. Share expertise and resources to sustain a transition to inclusion. Targeted financing to improve access to education for vulnerable sections. Engage in meaningful consultation with communities and parents to overcome discriminatory beliefs about gender, disability, ethnicity, race, or religion. Ensure cooperation across government departments, sectors, and tiers. Make space for non-government actors to challenge and fill gaps. Apply universal design, where all children should learn from the same flexible, relevant, and accessible curriculum, one that recognizes diversity and responds to various learners' needs. Prepare, empower, and motivate the education workforce to prepare all teachers to teach all students. Collect data on and for inclusion with attention and respect and avoid any labeling that stigmatizes. Now let's come to the next topic, number 6, that is National Institutional Ranking Framework, NIRF. So why was this in the news? Recently, India Rankings 2020 under National Institutional Ranking Framework NIRF was released by the Ministry of Human Resource Development. Related news: QS World University Rankings. Recently, QS World University Rankings for the year 2021 were published. It ranks universities on 6 metrics: academic reputation, employer reputation, faculty or student ratio, citations per faculty, international faculty ratio, international student ratio. IIT Bombay, Indian Institute of Science, Bangalore, and IIT Delhi featured in the top 200 list. The top 5 Indian Institutes of Technology and the Indian Institute of Science have all dropped, and the total number of Indian institutions in the top 1000 global list has also fallen from 24 to 21. Reasons for drop in rankings include low ratio of international faculty and students and poor faculty-student ratio. About NIRF India Rankings 2020. The NIRF was launched by the MHRD in 2015. This framework outlines a methodology to rank institutions across the country on a yearly basis under 10 categories: overall university, engineering management, okay, overall university, engineering management, pharmacy, college, medical, law, architecture, and dental, newly added in 2020. Objective of these rankings: to act as a guide to students for selection of universities based on a set of criteria, helps universities to improve their performance on various ranking parameters and identify gaps in research and areas of improvement. Ranking of institutions at national level instill a competitive spirit amongst institutions to perform better and secure higher rank in international ranking. NIRF is a voluntary exercise where only institutions that submit required data are ranked. A total number of 3,771 unique institutions offered themselves for ranking under overall, category specific and or domain specific rankings for India Rankings 2020. Now let's come to parameters. The ranking framework evaluates institutions on 5 broad generic groups of parameters. Number 1 would be teaching, learning, and resources. It includes sub-parameters such as student strength, including doctoral students, faculty-student ratio, financial resources and their utilization, etc. Research and professional practice. It reflects quality and quantity of publications, IPR, and patents published and granted by the institution, etc. Graduation outcomes of university examinations and number of PhD students graduating. Outreach and inclusivity. It measures regional diversity, gender equity, accessibility for physically challenged students, enrollment of economically and socially challenged students, perception ranking, etc. Peer perception among academic peers and employers. Top institutes. Seven Indian Institutes of Technology (IITs), Indian Institutes of Science (IISc), Jawaharlal Nehru University (JNU), and Banaras Hindu University (BHU) were ranked as the top 10 educational institutions of 2020 in the overall category by the National Institutional Ranking Framework (NIRF). The 3 top ranked universities were IISc, JNU, and BHU. The 3 top ranked colleges were Miranda House, Lady Shri Ram College for Women, and Hindu College, all part of the Delhi University. Rank, institution, and state. The first one is IIT Madras, which is in Tamil Nadu. Second is IISc, Karnataka. Third is IIT Delhi, which is in Delhi. Fourth is IIT Bombay, which is in Maharashtra. Fifth is IIT Kharagpur, which is in West Bengal. Sixth is IIT Kanpur, which is in UP. Seventh is IIT Guwahati, which is in Assam. Eighth is JNU, which is in Delhi. Ninth is IIT Roorkee, which is in Uttarakhand. And 10th is BHU, which is in Uttar Pradesh. Now let's come to the seventh topic, that is State Food Safety Index for 2019-20. So why was this in the news? Recently, Food Safety and Standards Authority of India, FSSAI, released the results of second State Food Safety Index on World Food Safety Day, that is June 7th. About FSSAI. It has been established under Food Safety and Standards Act 2006. FSSAI has been created for laying down science-based standards for articles of food and to regulate their manufacture, storage, distribution, sale, and import to ensure availability of safe and wholesome food for human consumption. The Act also aims to establish a single reference point for all matters relating to food safety and standards by moving from multi-level, multi-departmental control to a single line of command. Ministry of Health and Family Welfare is the administrative ministry for the implementation of FSSAI. FSSAI Initiative. Eat Right Movement. It is to improve public health in India and combat negative nutritional trends to fight lifestyle diseases. So this is Eat Right Movement. It is an initiative of FSSAI. Next is Blissful Hygienic Offering to God, BHOG, Bhog. To encourage places of worship, POW, to adopt and maintain food safety and hygiene, as well as convey food safety messages through such places to the people to follow as responsible citizens. Hygiene Rating Scheme is an online transparent scoring and rating process which aims to allow consumers to make informed choices about the places where they eat out and through their choices encourage businesses to improve their hygiene standards and thus reduce the incidence of foodborne diseases. Next is Heart Attack Rewind or Heart Attack Rewind. It is the first mass media campaign of its kind with support FSSAI's global target of eliminating trans fat in India by the year 2022. FSSAI CHIFSS. FSSAI has joined hands with CHIFSS CIIHUL initiative on food safety sciences with the purpose of driving activities related to science-based food safety in the country to strengthen protection of consumers and create an innovative environment for the industry. More on news. The index is a dynamic quantitative and qualitative benchmarking model that provides an objective framework for evaluating food safety across all states or union territories. It is an incentive to create a sense of competition among states to improve food safety. This index is based on performance of state or union territory on five significant parameters, namely human resources and institutional data, 20% weightage to check availability of strong culture and ecosystem of enforcement, compliance, 30% weightage, measures overall coverage of food businesses in licensing and registration, food testing, infrastructure and surveillance, 20% weightage, measures availability of adequate testing infrastructure with trained manpower in the states or union territories for tasting food samples. Training and capacity building, 10% weightage. Training and capacity building of regulatory staff and laboratory personnel. Consumer empowerment, 20% weightage. Measures the performance of states or union territories in various consumer empowering initiatives of Fssai. To ensure comparison among similar entities, index is divided into three categories: state or UTs topped in 2019-20 index. Large state, Gujarat followed by Tamil Nadu and Maharashtra. Small state, Goa followed by Manipur and Meghalaya. Union territories, Chandigarh followed by Delhi and Andaman Islands. Now let's come to the eighth topic, that is Swachh Bharat Mission Phase 2. So why was this in the news? The operational guidelines for the second phase of the Swachh Bharat Mission Gramin SBMG Phase 2 were recently released by the Department of Drinking Water and Sanitation, DDWS, Ministry of Jal Shakti. About SBMG Phase 2. SBMG Phase 2 will be implemented from 2020-21 to 2024-25 in mission mode, with a total estimated outlay of Rs 1,40,881 crores. It will use a novel model of convergence between different verticals of financing and various schemes of central and state governments to saturate the sanitation facilities for achieving the open defecation-free ODF plus villages. And ODF plus village is defined as a village which sustains its ODF status, ensures solid and liquid waste management SLWM, and is visually clean. Components of SBMG Phase 2: construction of individual household latrines and community sanitary complexes, retrofitting of toilets, works for solid waste management, biodegradable waste management. It involves composting at household and community level and using GOBAR, Gobar Dhan, galvanizing organic bioagro resources Dhan, scheme to convert bio-waste into biogas and bioslurry to provide economic and resource benefits to farmers and households. Plastic waste management. works for liquid waste management, grey water, and fecal sludge management. Guiding principles for implementation: ensuring that no one is left behind, community assets for SLWM to be prioritized and financed, utilization of existing SLWM infrastructure wherever possible, SLWM activities related to reuse to be promoted, convergence with other schemes, Jal Jeevan Mission for grey water management, finance commission funds for co-financing of assets, MG Naregas for for dovetailing of funds and functionaries, MG Naregas for dovetailing of funds and functionaries, Ministry of Skill Development and Entrepreneurship for skill development of field functionaries, National Rural Livelihood Mission NRLM for involving self-help groups as vehicles for behavior change communication, New National Biogas and Organic Manure Program NNBOMP scheme and sustainable alternative towards affordable transportation SATAT scheme for Gobar Dhan projects, use of business models or creating self-sustainable revenue models, operation and maintenance as an obligatory component of planning, encouragement of technologies with low operation and maintenance cost, flexibility of states and clustering of villages for maximum economic efficiency, priority to villages on the banks of Ganga and other water bodies. Now let's come to the guidelines. Planning. State governments and union territories would develop. The first one is Project Implementation Plan PIP for the entire period of the program from 2020 to 2021 to 2024 to 25, based on all the sanitation activities to be taken up in the villages, blocks and districts. Annual Implementation Plans AIP, every year consolidating the district Swachhta plans. Each district will prepare a district Swachhta plan after consolidating village action plans for its Gram Panchayats and incorporating the interventions to be taken up at block and district levels. Now let's come to funding. SBMG is a centrally sponsored scheme with fund sharing pattern between center and states being 90:10 for northeastern states, Himachal Pradesh, Uttarakhand and UT of Jammu and Kashmir. 100% from center for remaining union territories and 60:40 for other states. Funds will be released to states or union territories based on their performance and ability to achieve program results. Eligibility criteria. The first is the state cabinet passes a resolution to implement the SBMG Phase 2 and commits timely release of state share for the program. Number 2 is the state has set up suggested institutional arrangement for implementation and management of SBMG Phase 2 components. The third is it agrees to devolve funds to gram panchayats for co-financing of SBMG components and develops a PIP and AIP. Institutional arrangement. National Scheme Sanctioning Committee (NSSC) to approve or revise the preceptive plan called the PIP for the states or union territories and the AIP submitted by the State Level Scheme Sanctioning Committee (SLSCC). Apex Committee at the state level to aid and advise the state SBMG, SSBMG. Implementing bodies at state, district, block, and village levels. Monitoring and evaluation. The DWS at the central level shall lead the monitoring and evaluation function in coordination with states and districts. Progress will be monitored using an outcome monitoring framework. Methods of monitoring will involve an online integrated management information system IMIS, geotagging all assets constructed under the scheme, annual monitoring through Swachh Sarvekshan Gramin SSG. Social audit meeting held in each GP once in 6 months. For more details on SBMG Phase 2, please refer to Vision IAS Current Affairs March 2020 edition. So that's all, guys. Bye.